Recovery is not a solo endeavor. It's a team sport. You need a community around you to cheer you on, to lend an ear, to pick you back up when you fall. That's what Foundation's Recovery Network's Life Challenge program is here for. We are a positive, motivational community aimed at breaking down life's barriers and celebrating the accomplishments along the way. Our motto is, Dear Life, Challenge Accepted. Are you up for the challenge? Go to lcaccepted.com or call 615-221-5861.
That Sober Guy podcast contains adult content, merciless truth, and emotional nudity. Listener discretion is advised.
Yo, what's up? Welcome to Sober Guy Radio. Thanks to Humans for bringing us in, and thanks to you for supporting the show. We're live on the last day at Innovations in Recovery Conference in San Diego, California, at least my last day. And it's brought to you by Foundation's Recovery Network, the amazing sponsor of Sober Guy Radio. Big thanks and much love to them for bringing us out to hang out with some great people, talk some recovery, and help spread the word of hope and meet some great people. It's awesome weather here, as usual. And we have some great guests. We've had some awesome guests lined up, so be sure that you go back and listen to this whole series. That's the IIR 2017 Sober Guy series with all the great guests. Today we have the chair of American Addiction Treatment Association, Harry Nelson, joining the show. And Harry's here to talk about some very interesting things, and I'll let him get into that. Harry, welcome to the show, man. Thanks for coming.
Shane, it's great to be with you today.
Yeah, so let's jump into a little bit about the AATA, or American Addiction Treatment Association. What are you guys up to there?
So yeah, we started American Addiction Treatment Association, AATA, about a year and a half ago. And basically it was built, for about 15 years, I've been working as a lawyer and consulting with addiction treatment professionals and programs around the country. And we had a lot of information that we've developed in working with people and solving problems around fraud and abuse and reimbursement. And so we basically wanted to find a way to get information out to the industry. Our feeling was that the addiction treatment space would be a lot better, that life would be easier for providers, and that care would be better for patients if we could help spread the word and help establish standards of best practices around a lot of confusing issues.
Yeah, definitely. So there, because, and we kind of chatted before, you just say the word insurance, and I almost cringe because it's a tough topic, and I know many people feel like that. Many families out there, with all different kinds of elements to it, it can be very, very confusing at times. What are some things that you can provide to help just the general dude like me, or the general family out there listening, that might help them understand it a little bit better?
Well, I think it's very confusing. You know, the world of coming into an addiction treatment program, distinguishing between good programs and programs that have work to do. Yeah. Between safer ones that
I like how you worded that. Nice.
He's a lawyer. You got to be careful.
Yeah, absolutely.
Optimal. We say suboptimal a lot. Yeah. So it's very important as somebody who's, whether you're a potentially a client or a family member, it's very tough to sort out which programs are really doing a good job, are using evidence-based proven approaches. And unfortunately, like everything, sometimes there are places that have good intentions but aren't engaged in best practices, and sometimes, unfortunately, you have people who get more focused on the bottom line than they do on patient care. And so we've tried to help establish standards around things like marketing and what are appropriate marketing practices, things like urine drug testing. A lot of the areas where addiction treatment is still sort of catching up to a lot of the rest of the healthcare world. Yeah. How
does that relate to how does healthcare and insurance relate to the recovery industry? We're hearing a lot right now about coverage for people who are in recovery who need help but don't have access to treatment, maybe because they don't have an employer providing them insurance. Or how does your work that you're doing play into that, and how can people get help if they need it?
Sure. it's a little bit of a feast or famine situation. Before we had the 2008 Mental Health Parity Act, and before we had the Affordable Care Act and the minimum essential coverage requirement that every insurance plan cover addiction, substance use disorder treatment, it was very hard. If you had really good coverage through a large company with a generous benefit, you might have coverage. But for most people, most middle class people, their insurance didn't include anything to help with addiction treatment.
Yeah.
And so all of a sudden, we started seeing around 2012 just a boom, and it was, in many ways, it was great news for the industry that finally insurance companies had to provide coverage. But like everything, it was given and then it was taken away, and a lot of.
Yeah.
So we try and help people understand exactly how the insurance industry works, what the insurance companies are looking for, how to make sure that you meet documentation and medical necessity standards, and how to be on the lookout, because it's a constant cat and mouse game.
Yeah.
The insurance companies have a big pool of money that gets paid to them, whether by your employer or by you if you buy an individual policy, and they're trying to figure out how to hold on to as much of that as possible and not pay for the care that you want or you need. And so, and frankly, a lot of patients are disconnected from how much it costs, and they don't even realize what's being billed in their name. So there's a lot of gray area where people can discover that that their benefit was all used up if they're not careful. There's a lot of tricky things to navigate. So we have a lot of experience over the years working with hospitals, nursing homes, doctors groups that we've been able to take and apply to addiction treatment. And it's really this. At the end of the day, the insurance industry is the same. The service is different, right?
Yeah.
PHP and IOP and the things that people in the addiction treatment world.
A lot of acronyms.
Yeah. This whole world is all just, you got to know the acronyms. But even though the terms are different, fundamentally the services are in the same category and they play by the same rules. And so it's about knowing what the coverage what the medical necessity requirements and scope of coverage are, knowing what the benefit is. And unfortunately, there's often a lot of fighting to make sure that you get covered, to make sure that the providers get paid. And so that's an area where we've got a lot of hand-to-hand combat over the years.
Yeah. Obviously, there's a lot of talk right now in the political perspective from healthcare, moving forward with healthcare. How does that relate to the recovery community itself? Frankly, I'm pretty much tired of all of it. We all have our own personal opinions, of course. Whatever, that's our own view. With directly related to the recovery community, let's start with. How is healthcare affecting the recovery community, or how is it helping the recovery community as it stands right now? And then after that, let's get into moving forward.
Sure.
What are some things that we might see?
So we're in a period of transition, right? So I said in 2012, ObamaCare, the Affordable Care Act, established that substance use disorder treatment was part of the minimum essential coverage. It didn't matter if you had your plan from a large employer or a small employer, an individual plan bought on a health exchange, insurance exchange, you were entitled to it. Now that's been thrown into question. We're in a period of transition. So on January 20, President Trump's first day in office, he put an executive order in place that said federal agencies should relax some of the enforcement of the Affordable Care Act. So insurance companies, whether you're a patient or an insurance company, it's a time of confusion right now.
Yeah.
The insurance companies are trying to figure out how to sell insurance products and how to do so profitably. And I'm not. It's not. A lot of times people think it's good and evil. It's really a business proposition. So they're confused. They are providing substance use benefit. So the good news is that the benefit isn't going away, but it's also confusing. It's confusing for patients, right?
What was it before, prior though to 2012? If so, not every, just to help me understand it, not every insurance provider was obligated to send somebody through treatment if they needed it. Is that, to my understanding, how
that's
it would
correct?
Work?
Yeah.
And once that went in place in 2012, they were basically now obligated to do that. No questions asked.
Yeah. So if you go back 10 years ago, I'd say 10 years deliberately, because 2008 was also the Mental Health Parity Act was a big change in the law. But if you go back pre-2008, basically it was up to the insurance company. Addiction treatment was viewed as not necessarily part of healthcare. So some plans did cover it. If you worked for a large company that had a generous health plan, many of them covered it because they had a big workforce and it was a practical issue.
Got it.
If you have thousands of employees, you're going to have people who have addictions and need addiction treatment, and so a lot of them provided it. But a lot of those small employer plans and the individual plans didn't. They either had no benefit or very, very limited benefit for an outpatient program. So what happened in 2008 was mental health parity, what was the federal law that said insurance companies can't discriminate between behavioral health conditions, expressly including addiction, and medical conditions. It's all one and the same. But that was a first step, and insurance companies weren't quite sure what they were required to do. So we saw a little bit of movement in those years, but it was more, the fundamental idea with parity was that they couldn't discriminate against addiction treatment. It didn't say they had to provide it. That was where the Affordable Care Act came in.
Okay.
So the Affordable Care Act, with the minimum essential coverage, it said insurance companies, you must provide this as part of your package. Everyone, and so now we're at a period where part of what the Republicans are coming back and saying is, well, if you force everybody to have this coverage, maybe not everybody wants it. The example that the Republicans always give is of pregnancy coverage, right? If I'm a 25-year-old unmarried man, why should I pay for pregnancy coverage? So the Republicans want patients and insurance companies to have more freedom to figure out what policies work for them, and so they want to take away the requirement and make it more of a flexible benefit.
And is that kind of the individual mandate? Is that what that equates to?
So the real question is, the individual mandate was part of the Affordable Care Act. The question was, how are you going to pay for all these uninsured people? You had 40 to 50 million, depending on whose numbers you use, people before in 2007, 2008, you had about 40 to 50 million people without insurance. A lot of them were people who were unemployed and people who had jobs that were lower paying jobs that didn't include insurance. Yeah. So the question was, how are we going to pay for? And a lot of these people were sick people with chronic conditions, a lot of diabetes, heart disease. So we knew that when the Affordable Care Act opened the floodgates and basically said we're going to make insurance affordable for everybody, that there were going to be a lot of sick people, and the question was how to pay for it. And the answer was to make young, healthy people pay for it. So the individual mandate, the whole point was, basically, if you look at a graph of when healthcare costs really start to rocket, for most people it's in their late 50s. That's when the diabetes, the heart disease, the lung disease, all that stuff hits. Yeah. And it's like in the United States, it's an upward curve. I'm talking about that later today. Yeah. So the question is, it's all those people in their 40s, 30s, and 20s. It's a little bit like the idea of Social Security. The idea behind the mandate was, we'll make those healthy people pay in, and that will give us a pool of money to deal with the sicker people who need care.
Yeah. What if I die when I'm 39, though? I don't get any return on my investment, damn it. No.
It's a little like Social Security that way.
Yeah, yeah. So what is in your, like, what are you seeing moving forward, man, in the healthcare industry, in the addiction and recovery community?
I think it's, in some ways there's a little bit of a constant battle between insurance companies and providers, because providers always want more money to give more care, and insurance companies, like I said, are trying to protect that pool for the catastrophic event. And so what we see happening is, the last 7 years have changed the way that it's been a learning process for both the industry and for insurance. And so it looks like we're entering a period now, at least for the next 4 to 8 years, where the insurance companies are going to have a lot more flexibility. Yeah. But the benefit is, it's not going away, but we think it's going to push towards lower costs, a much more evidence-based standard. So for example, one of the things I'm talking about today is we see a growing role of outpatient, including outpatient detox, and a smaller role for residential. It's not that the benefit's going to go away; it's just going to be more limited. And so it's going to, the reality is there's going to be opportunities for plenty of addiction treatment providers, and there'll be services, but they're going to be more value oriented, and not it's not going to be the high end treatment programs are going to be, if people are going to those, they're going to either have a very generous insurance plan from a big employer, or they're going to be paying out of pocket. Yeah, and I can't remember now what word it is exactly, but the guy you mentioned a couple times about guidelines and about standards. I think it was standards. It seems like that there's a lot of standards that are just not clear yet. And is that kind of some of the things that they're working on, and that your work that you're doing is helping to establish those standards and have some set guidelines to follow, to do things the right way, I guess? Yeah, I think my sense is that for most of until the last 7-8 years, this was kind of, nobody was really, the government and insurance companies weren't worrying about addiction treatment because they weren't paying for most of it. Yeah. So, for example, addiction treatment wasn't under the same pressure as, say, cancer or heart disease to meet evidence-based standards. And so people were, and I'm not taking I don't have a dog in this fight, but the whole issue of whether the social model, abstinence-based works, or whether it should be a medication-based approach. We're seeing that play out, that fight over what's the right approach play out. And right now, and it's funny, it's the kind of issue that in other parts of healthcare played out 20 years ago or 40 years ago, and it's only because once you have the scrutiny of government and reimbursement, and it was only after the insurance industry started paying for it that they started driving this intense focus.
Yeah, interesting, man. Yeah, it's definitely a lot of elements, a lot of components. I'm glad this is your job and not mine. I know you probably have a ton of work that you're into. If anybody wanted to reach out, wanted to get more information, where could they find you at? Where could they find more information?
So the AATA website is addiction-tx, as in treatment, addiction-tx.com. I'm at Nelson-Hardiman.com. That's my law firm. I also have a book out that I'm talking about this afternoon.
Nice.
From ObamaCare to TrumpCare, Why You Should Care, and the website on that is TrumpHealthCareBook.com.
TrumpHealthCareBook.com. I'm going to check that out definitely.
We're excited about it. We actually just found out yesterday that from a senator ordered 100 copies for Senate colleagues, and the book's being passed around on Capitol Hill. So we're getting a lot of good buzz.
That's
about it.
awesome, man. I'm going to have to check it out. I like the cover too. The cover is like perfect.
Uncle Sam. We didn't want to it's like a Uncle Sam with a thermometer. He's a little sick, but he's he's going to be okay. That's our message. It's going to be okay.
The message of hope right there. I love it. He's a little sick. We're all a little sick, but we're going to be all right. When did that come out?
We came out with it second week of January. So
so recently then.
Yeah, it was right after the election. We wanted to really try and we were trying to be hopeful. There's a lot of people worried right now in addiction treatment, and frankly across the United States, some people are excited about the change. A lot of people are worried about it, and our big point was we need to have a constructive dialogue because it's complicated stuff. Addiction treatment is complicated. Healthcare is complicated, and the only way we get to a better system is by really working together across political differences and
and I think the issue if we're talking about recovery, that's the main issue here, and we should all be able to come together and kind of set individual opinions aside, I feel like. But I do got to say this one thing that I don't think gets enough attention is the fact that our president has a personal connection to the recovery community with his brother. His brother passed away from alcoholism. I don't hear people talking about that enough, and I think that with all the other BS that's going on, it gets overshadowed, and that's for me personally in this community. That says a lot about a person, and the fact that he's sober too, doesn't drink, doesn't use drugs, never has in his life. Why aren't we talking about that more in this community?
I think it's a great point, Shane. You're making a fantastic point. People don't engage on that issue enough, and I think we need to move away from negativity again, regardless of whether you agree with the policies or not. I think he does have a very human approach, and I think really engaging with his personal connection to this issue and the way it's affected his family would be a powerful thing.
Yeah, because we all connect when we have a personal connection to it, when there's a story behind it, and we can all relate to that. So I would say, I would love to talk more about it, and I hope to hear other people bringing it up a little bit more. I mean, it's been touched on here and there, but I think it is a very, like I said, I don't want to repeat myself too many times, but it is a very important issue, and it's not being talked about enough.
By the way, it's interesting. A lot of people think that the Republicans just want to roll back all of care, but one of the things that's interesting to note is that they are actually going to start forcing more addiction treatment, opioid treatment programs into the states, because it is a priority, right? There are different visions about what the right way to go about addressing the need is, but it's also there's clearly it's a priority. It's a priority for on both sides of the aisle, just different approaches.
Yeah, definitely, man. Well, what time is your? Are you speaking to?
3:30. I'm speaking.
3:30. Yeah, nice. And are you talking about Trump Obamacare?
Yeah, it's called. The title of the talk is "From Obamacare to TrumpCare: What's Next for Addiction Care."
Got it.
So I'm excited to have a chance to share some ideas, and hopefully it'll give people some things to think about as they go forward, whether they're patients or providers, and thinking about the next steps in the industry.
I like what you're doing, and I really get the feeling that that you're helping some people come together and connect and not focus on the negative stuff that's going on right now, because there's a lot of that, and it tends to override, I think, through media, the actual truth behind what's really going down.
I appreciate it. No, my sense is that the media just oversimplifies stories because we have short attention spans. They're getting shorter by the minute, and we got to make the story really simple. And unfortunately, when it comes to addiction treatment, that means headlines that are just unfortunately not. They often are focusing on the ugliness.
Yeah.
And the reality is that almost the vast majority of people are trying to do the right thing. It's very rare that somebody and the real story doesn't get out there. So
yeah,
I appreciate it. I hope that our work will help get that message out there.
Yeah, Harry, give out the website one more time, man.
It's addiction, www.addiction-tx.com, addictiontreatment.com. And the book, yeah.
The book, go ahead.
The TrumpHealthcareBook.com.
Yeah, check it out, folks. Harry, thanks for joining us today.
My pleasure.
Innovations in Recovery, San Diego, Sober Guy Radio coming to you. Big thanks to Foundations Recovery. Peace, love, respect. Go to thatsoberguy.com for more information. Keep your blood clean.